feel pain when I get solid material.
Solid. For how many days you feel? It is progressing in nature or static in nature. Your problem
It's progressive.
progressive. Have you any history of bleeding or bleeding per mouth or with vomitus?
No, doctor.
Okay. Have you any history of weight loss or loss of appetite?
Yeah, doctor, I have lost some weight. And
How many?
also,
How many?
uh,
How many kg in last
I'm
4
not
months?
sure. I'm not sure, but my husband told me that I have lost some weight.
Okay. There is have you feel any acid taste in your mouth?
No, doctor.
Have you feel any chest pain or heartburn in the upper ischium, upper abdomen?
No, doctor.
Okay. There is any history of past medical history or any history of hospitalization previously you have or any surgical history?
No, doctor.
Okay. You have any history of allergy or to any foods or drugs or medicine?
No, doctor.
Do you have any history of smoking or alcohol taking?
Yeah, doctor. I am a smoker.
How many stick you have take per day?
2 to 3
For how many years?
for the last 10 years.
Oh, okay, Marufa. Have you any positive family history or any history of same type of disease in your family member previously?
I didn't understand about positive family history. What do you want to say?
Uh, any of your family members suffering such type of illness?
No.
Okay. What is your job? Where you live in?
Okay. I work in a factory.
Please continue. Are you done?
Okay.
Are you done? Please continue. No problem, brother. We're here. We're listening.
I think I have completed history.
Okay. So, complete your. Would you like to tell us the present your history or tell us the only the positive findings?
Uh, he has history of only positive findings, difficulty in swallowing of solid foods for last 4 months, and associated with loss of appetite and weight loss, which is unintentional, and she is a smoker.
Okay. Then.
And non-alcoholic, but non-alcoholic, and the difficulty of swallowing is progressive in nature, and no hematemesis, no history, no history of bloods with vomits. And now I should clinical examination the patient and some relevant investigation for diagnosis this patient.
Okay. So, what's your DD differentials?
My differential diagnosis is esophageal carcinoma. Another one is achalasia cardia, and esophagitis, and
So how
GERD.
would you differentiate by the history between the esophageal carcinoma and the achalasia cardia?
In case of achalasia cardia, this will be difficulty in liquid to solid because and it is a motility disorder. In case of esophageal carcinoma, it is difficulty will be solid to liquid, and will be progressive in nature.
Okay. So how would you like to treat the patient?
I will this patient be treated according to multidisciplinary team approach uh, with surgical oncologist, hematologist. Uh,
Suppose
and
this is a like it is a 80 years old female, and her as upper esophageal carcinoma is have been diagnosed, and this is a non-operable case. So how would you treat the patient?
in case of non-operable, I should go for palliative therapy like like uh, metallic stenting or chemoradiotherapy, palliative chemoradiotherapy, or pharyngectomy.
Okay. Okay, that ends our history. So, Dr. Riaz Bhai, so just criticize yourself. How was it?
This is the first time for me. I think there is so much lackings for me in history taking.
Okay, no problem. You did, or uh, just I would like to know the things you did in the mistakes, whether you got it or not. Just tell me what was your lackings in the history taking. Tell you what was the lackings, but I would like to know at first from you what are the lackings.
Um, taking consent from the patient.
Mhm.
I think take the consent. Um, in case of presenting illness, I should elaborate the history.
Okay, so guys, all of you, I would like to share all of you. I would like to say one thing. Always remember, this is not the exam of language, other than this is a exam of MRCS Part B exam. If you are not good enough with the English, nothing will happen. I can assure you, if you are not good with the English, don't be panic. Don't be panic. Nothing will happen. Just express yourself. Because there is no question who bears 2 to 3 lines. Just all the questions 2 to 3 words, uh, 1 line maximum. You don't have to say so many things other than using a single sentence or these things. So if we're not very good with the English, nothing will happen. I have seen a person who used to practice in a known group, and just I was just wondering, he is going to appear in the MRCS Part B exam in Kuala Lumpur last year in the Kuala Lumpur, Edinburgh. Dr. Sharma is going to give her exam there also. And I was just wondering that he was not able to make a complete sentence very perfectly, but he really passed. And
Like me.
no, you are much more better. No problem, brother. I am just making you sure, and I am just making you confident, and I'm making you assured that is not the exam of English. Nothing will happen if you are not that much fluent with the English.
Thank you.
But express yourself what's going on your mind. Just don't about the don't look for the perfect word. Just say yourself, just what is on your mind. Just say the word. If you are not enough to make a sentence, just say the words that you would like to express, right? So the main thing is, remember, it's not the exam of English, it's exam of skill or exam of knowledge. That if you don't that much good with the English, don't be panic. Nothing will happen. They are not just um, just follow the instructions, make your facial expression, what I have already said. So, Dr. Riyad Bhai, you do have some lackings with the whole history, I think, because there is a complete history taking formula, I think, but you do have some lackings with the history. Let's come to the points with the history. So at first, you have to give the your identity. Hello, I am Dr. Rifat. Hello, I am Rifat, one of the surgical candidates. Then you will have to confirm the patients, and Dr. Marufa was just thinking he's not asking my name and age, what do I say? So Marufa, Marufa was a good actor, but Dr. Riaz Bhai didn't even ask her name, also age. So you'll have to identify the patient's identity, right? Hello, I'm Dr. For one of the surgical candidates. May I confirm your name and age, please? It's the second question. So today I have been asked to third one is verbal consent. Today I have been asked to ask a few questions that you are suffering from verbal consent. Verbal consent. So fourth one is you have to seek the permission, because while you are taking the history, you would like to take some notes from your papers. So you'll always have to seek the permission from the patient, because you are interrupting during the conversation. You are taking some notes, and these things are really matters in your MRCS OSCE exam. So you will have to very much.
How will you take the permission?
Yes, I'm going to take some history. While I'm taking this history, I would like to take some notes. Are you comfortable with that? Like this way. So you'll have to take the permission for taking the notes. Taking notes.
Okay.
Notes.
Yeah, I have a small question. Can you hear me?
Sure.
Yeah, like when we take the history, okay, is it like, can we write it down in a paper, like while talking with the patient and everything?
Yes, I already mentioned once. Wasn't you there?
I was like, maybe I missed it by
Okay.
something happened. Okay.
Then I will show you the technique how to take the notes very quickly and very professional way while you are talking with the patient. So come to Dr. Riaz Bhai, and then you will have to take
Yes.
Bhaiya,
permission.
sorry, Bhaiya. Sorry for the interruption. I have a question.
This Dr. Nahida.
No, Dr. Marufa.
Oh, okay.
Bhaiya, I have heard Dr. Mohammad Reza told once that when candidate are writing the notes, is there any chance of losing marks?
No. You are allowed to write. If you are not,
Okay.
if you are not allowed to write, then papers and pen wasn't there. So you
Okay.
have marks to make the to write it down, because you can write the patient name, patient age, and only the positive findings. I always would suggest you to take the only positive findings to write it down, because what
Okay.
discussing with Dr. Sharmin, I told her that always emphasize while you are writing the positive findings, because these are the most important thing. So when the patient will
Okay.
give you the positive finding, just mention that, okay, I'm writing it down. I'm writing it down, so the patient, you can grab the concentration of the examiner, so that you will have some marks on that point, right? So if
Okay.
you are not allowed to write, so the pen and paper wouldn't be there, right? So
Okay.
you do have marks on that.
Okay, Bhaiya. Thank you.
Welcome. So come to Dr. Riaz Bhai. You do have 4 points before starting the history taking. Then come to the fifth point. What seems to the problem today? What seems to the problem today? These are the 5 questions that are fixed in every patient. other than erectile dysfunction or one or two stations, disoriented patient in that case. But other than every single station, you will have to practice like this way. Okay, would you please practice like with me? These 5 questions, Dr. Riaz Bhai.
Hello, I am Dr. Riaz Mahmood. I am one of examining candidates today.
Okay.
Would you please confirm your name for me?
Name and age, please.
Name and age, please.
Dr. Rifat.
Would you confirm your name and age, please, for me?
Yes, I'm Dr. Rifat, 31 years old.
Okay, thanks. I have been asked today to take some history from you for those your sufferings.
No history. I have been asked to take you some notes like this way. Just not.
I have been asked to
talk to you like this way. Use not history
I have been asked to talk to you
regarding your problem.
Okay. I have been asked today to talk to you regarding your problems. Would you please tell me are you okay? What about taking notes?
Yes. Okay. Just
verbal consent.
I'm telling you this time and practice with it because you are looking for a reading partner. I think you found Dr. Tanvir here, and he's a very expert. So just practice with Dr. Tanvir. Hello, I am Dr. Ifat, one of surgical candidates. May I confirm your name and age, please? Would I have been asked to ask you a few questions regarding your problem that you are suffering from? May I confirm? So while I am taking the notes, while I am talking to you, I would like to take some notes. Are you comfortable with that? Then finish with the question, what seems to be the problem today? These are the 5 questions preset in every section other than 2 stations. So you'll have to, you just practice like this way. So every single question from here to have marks. If you don't practice like this way, you will lose some marks. So always history taking stations are very important. So you'll have to focus on the history taking stations, and these are the stations on your completely on your hand. So you will get some marks on this portion. So don't ignore the history taking. These are the most important thing and to place to acquire the mark, right?
Right.
Okay. So okay, that's okay. And okay, is there Dr. Israt? Is there anyone who would like to practice with the acute pancreatitis or chronic pancreatitis? Anything else?
I want to practice acute pancreatitis.
Who is this?
Marufa.
Okay, Dr. Marufa. So
I want to be volunteer here.
Okay.
For practicing.
Okay. It is your turn, Dr. Tony. Sorry, Dr. Marufa. Just writing, read it. Speaking. You do have.
Okay, Bhaiya. You are a surgical SSO on call, asked to take history from a patient who has acute onset of epigastric pain after alcohol drinking. He had PUD. Okay, I am going to start.
Your time is started.
Okay.
I'm Dr. Marfa, one of the exam candidate here. Can I confirm your name and age, please?
Yes, my name is Riaz Mahmood, 35 years old.
Okay, nice to meet you, Mr. Riaz. Today, I have been asked to ask you some question regarding your problem. Are you okay with that?
Yes, I am okay.
Okay, during our discussion, I'm going to note down some point. Are you comfortable with that?
Yes, I feel comfort.
Okay, thank you. How can I help you today?
Doctor, I am feeling very much pain in my upper part of tummy.
Okay, I am so sorry. Do you need any painkiller right now?
Yes, I have taken painkiller, but pain doesn't remove.
Okay. Do you need any painkiller right now?
No need.
Okay. Can you describe the pain for me? Like where exactly where you feel the pain?
I feel the pain upper part of tummy.
Okay. And how long you are suffering for this pain?
I am suffering from this pain for last 10 years.
Okay. Uh, have you noticed and do you have any vomiting during
Yes,
the pain?
yes. During the pain, I am suffering from vomiting.
Okay. And have you noticed any blood in your vomitus?
No, doctor.
Okay. Can you tell me the nature of the pain? Is it sharp pain or dull itching pain?
This is dilating pain.
Okay. Uh, and does it go anywhere else or you feel it anywhere else in your body?
Yes, doctor. This pain goes my backside of the body. Go to the
Okay.
backside.
And does anything make it feel better or make it worse? Like
Yes,
changing your posture?
yes. During sitting forward, bending forward, I feel relief of some pain and
Okay.
some taking medication relieves some of pain.
Okay. Can you score the pain for me? 1 to 10. 1 is the lowest and 10 is the highest.
My score is I think 8.
Okay. I am so sorry. This must be very troubling for you. Have you noticed any yellow discoloration of your eyes or urine or your stool?
No, doctor.
Okay. Are you feeling unwell or feverish?
No, doctor.
Does the pain increases after taking fatty meal?
Yes, doctor.
Okay. Do you have any heartburn or acid test?
No, doctor.
Any shortness of breath or any increase in of your pulse rate?
No, doctor.
Okay. Do you have any history of trauma?
No, doctor.
Okay. Now I'm going to. Are you taking any medications?
Yes, I have taken medications like insulin for last 5 years.
That means you have diabetes, right?
Yes.
Okay. Have you admitted before in hospitals for any condition?
Yes. I have admitted 7 times in hospital.
Okay. Have you undergone any surgeries?
No. I have no
Okay.
history of surgery.
I'm going to ask you some personal question. Any of your
Yes.
family member are suffering this same problem?
No, doctor.
Okay. Are you a smoker?
No.
Do you drink?
Yes.
Okay. What do you do for your living?
I live in my cottage in house.
What do you do?
What is your job?
Profession.
Oh, okay. I'm a businessman.
Okay. Uh, with whom you are living recently?
My wife and one of my children.
Okay. And then what's your idea or what your concern about your problem?
I think I am feeling very much pain. It is so much disturb my life, and it is, I think, moribund in nature. I
Okay.
can
Okay. Yes.
tolerate this pain.
I can understand you, and don't worry, you are in good hand, and we will do some investigations and we'll complete our clinical examination, and then we'll rule out what is happening with you. And I'm going to ask you some question that you can answer with yes or no.
Yes,
Like, do you have any headache?
Marufu,
No,
Any problem with your vision?
no, no,
Any weakness or joint pain?
no.
Okay. Thank you for your time. I will come back to you as soon as possible after discussing with my consultants. Thanks for your time.
Okay, welcome.
okay. So, Dr. Marufa, how
Yes, Bhaiya.
was it?
I don't know, Bhaiya.
Allergy history now হয় না, history of allergy
Okay.
and insulin medication history কতবার নেওয়া হয়, মানে how many times in the day, any history of steatorrhea, steatorrhea, weight loss.
Okay, come to the point. The point is, always remember
Yes, Bhaiya.
things get in your exam exactly those things that are given in your textbook or the conventional books. These are the out question. You will have to read very properly. You will have to practice again and again, and you will have to perform in the real exam. Say in our center in Kuala Lumpur this October. In the first day, we have 4 days exam, and in the first day, my exam was on the fourth day. In the first day, the exact questions that came in the Sri Lanka station, almost 95% question overlaps in our station. So the most of the candidates who used to practice the previous mock, they had gone through all the questions who used to come in the Sri Lanka stations.
Okay.
So these are the open questions. In the second day,
Mhm.
almost 13 or 14 stations was from the first day. Almost, that means almost 70%, I think more than 70% question directly come from the first day. On the third day, almost such kind of questions that used to come in the first day and second day.
Okay.
On the fourth day, the questions was totally different. We got so many new stations like submandibular gland, shoulder examination, and so many things, and testicular and so many epidural. These are the new questions that didn't come in previous 3 days. So what was the real scenario was in the exam? The scenario was our 4 days exam was really good, but from the 4 days result was good, other than first, second, and third day. So all the questions are same in the second, even first, second, and third day, but still candidates have failed. Why? What's the reason? What do you think? So the first day, I told you some of our mentors or some of our hugely famous mentors, they run the hands-on course just before the exam day, but it is very unprofessional because skill is not the thing that will acquire within 7 days or 5 days. If it was easy to acquire within 7 days or 5 days, every candidate would pass in the second, first, second, and third day. So all the questions are same, all the questions are out. You'll have to practice, like Dr. Riaz Bhai have mentioned that he is having insulin, but in case of your real exam, the patient will not have any insulin other than lansoprazole, because lansoprazole is given in your textbook. Got it?
Okay.
They won't go outside this textbook, they won't go outside these findings, because these are the things, and also the actor also paid. So if they are not in good, they are not good in the acting, they won't be called second time subsequently. So they are
Okay.
very alert to have the chance to become the patient and hugely paid. So things are the same. Things are the same. You'll have to stick with the textbook, and they won't go outside the textbook. So I am saying all the candidates who are practicing, just try
Hmm.
to follow the textbook, what are given, whether it is given insulin or lansoprazole. So always practice with the lansoprazole, don't with the insulin, right?
Okay. Okay.
So you did well. Overall, you did well. Your time management was really good. You
Bhaiya, how many times? মানে, how much time I used?
you use almost 6 minutes and 30 seconds almost.
Okay.
So you at first, whenever he was start with the pain, your first job is to go with the Socrates, not other
Yeah.
than it. Because after patient saying about the pain, you discuss about the vomiting or something other those things. So don't go outside the Socrates as soon as you hear about the pain. So stick with the pain and just make a habit whenever you are asked, the patient is saying the pain, just try to ask the whole 10 questions or 8 or 9 questions what are you are preparing for. Just try to mention all the 10 questions or 8 questions at a time. Just make a into a habit. Just don't go other thing, whether you are having vomiting or headache or something else, don't go the other things. You will get the chance to ask the or another question later on. But
Okay.
the first job is to finish the Socrates, because you do have marks for the Socrates, right?
Yes. Yeah,
So
Bhaiya.
and Dr. Riaz Bhai giving that that patient is having dilating pain, and I was just wondering, I was just thinking, what are they saying? So when he was just saying dilating pain, because I am very much habituated, because I am myself is a urologist, and dilating pain really occurs in the kidney, not in the pancreas. Dilating pain, not in the pancreas, because in case of pancreas, in acute pancreatitis, there is sudden, severe, and agonizing pain. So the patient will always say,
This is sharp pain.
patient will always say,
She asked me sharp or dull.
whatever it is, but stick with the sudden, severe, agonizing pain.
See, sudden severe agonizing pain.
Yes. So it's not the dilating pain, always sudden, severe, and agonizing pain. Dr. Marufo also asks about the pulse rate. I think it's a medical jargon or medical term. So the patient, you will lose mark on that case. So you can ask the patient about the pulse rate, other than, are you aware of your heartbeats?
Right.
Okay. Okay.
Right.
Don't about the pulse rate, other than aware of the heartbeats, and don't use the medical terms like vomiting. I said, I think it's not, it's a local language. I think it's a common language. Everyone knows about the vomiting, but they always suggest us to say about the throw up, this kind of words. Right? You did well. You did really well. You are very much habituated with the time. You didn't waste your time in other things. You equally distributed on your all the portions, but I would suggest you try to practice again and again, and especially the Socrates, and about the evaluation of the main problem, and other, after having the differentials, the other questions that are set in your exam, just always try to the stick with the fixed questions, right? After having the differential, just go to the questions. Do you take any drug regularly? Are you allergic to anything? Are you allergic to any drug or any substance? Like this way, don't go to the
In
personal.
case of when I told I am I'm a drinker.
Okay.
She does not ask me how many
Okay.
dose of alcohol.
Yeah, that really don't.
Yeah, I was in a hurry of time.
This should be, I think this should be
Okay, that's important. For how long? That's okay.
Yeah,
But
Bhaiya.
one thing
Uh,
always remember: in case of personal issues,
yes,
patient
Bhaiya.
patient might say so many things. Once
Okay.
I had uh, 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 from a candidate that the actor said he's living with his 3 girlfriends. I don't know whether it's true or not. Then the candidate just started laughing, and though he has passed in the exam, I don't know whether it is true or not. But the actor will say so many things. So in case of personal issues, don't change your facial expression. Don't dare to interrupt in their personal life. Even a patient is having smoking, don't dare to tell smoking is very bad for you. Bad habit.
Dr. Rifat, what is the dose of alcohol? How I ask the patient, how many
packs?
packs?
Yes, how many packs? How many times in a week?
How many packs per day?
Okay, like this. So it's not per day, just for a week.
Week. Okay.
Okay, especially I think the duration is most important. For how long? That's important. How many packs in a week or for how long? Like this way.
Okay.
So, doctor, who was it? Participant? Who was the participant? Bubbly.
जी भैया yeah.
So, present your case.
Okay. Mr. Yes, 35 years old, presented with a severe epigastric pain, and he has also history of vomiting, and the pain is relieved on leaning forward, and it increases after taking fatty meal, and he has no other history of ulodiscalation of eyes, urine or stool, or any other abnormalities. So my main differential diagnosis is acute pancreatitis.
Okay. So, what are the treatment of
I think this will be acute or chronic pancreatitis. I have mentioned in the history. I am suffering from diabetes mellitus for a long time.
that means Dr. Arias is not a good actor, I think. Okay, he didn't give you all the positive findings that are mentioned in your textbook, so always stick with the textbook, right? So whatever, just tell me the treatment of the or management of the acute pancreatitis.
Okay, after completing the full abdominal examination, I will do some investigations like ECG and cardiac enzymes, and also serum lipase, amylase, serum calcium, and ultrasound of whole abdomen and chest X-ray. Then I will manage the patient according to CRIS protocol.
Care critically ill surgery.
Care for critically ill surgical patient.
Okay, they won't bother you in that portion a lot. You can mention I would like to treat the patient according to critically ill surgical patient protocol, admit the patient in critical area.
According to severity, I will admit the patient in SDO and
Okay.
open.
So, what is the pain management of this acute pancreatitis?
Um, is it via according to WHO pain management letter or?
Opioids দিতে হবে, morphine or pethidine,
Yes,
then
basically,
tramadol.
How should I go via? I directly I would tell morphine.
You can use according to WHO analgesic ladder. Depends on the
Okay.
patient. Like initially, pain management begins with the non-opioids like ibuprofen or acetaminophen, like NSAID. And if non-opioids and if it doesn't work, then mild opioids like codeine. And if mild do not relieve the pain, strong analgesic opioids, patient-controlled analgesic or epidural analgesic can be used. And now the question is, why not morphine is used in this case?
Morphine not. I don't know via.
Okay, this
Suppress the respiratory center.
morphine is
The side effect of acute pancreatitis is acute respiratory distress syndrome, right? It can cause. So that's why we will not give morphine, because it will cause the respiratory center suppression. Yes.
okay. These are the late complication, not that much late. Is one of the complications is ARDS or respiratory problem in acute pancreatitis, but the main problem in case of uh, not using morphine, because morphine causes constriction of the sphincter of OD. So, yes, the patient is having acute pancreatitis. That might be the one of the
Sphincter of OD also, because morphine is acting with mu receptor, right?
yes,
So
exactly.
in sphincter of OD, there is a mu receptor also.
Morphine basically use three more receptors. One of the important is regarding the pain. That one is mu that Dr. Sharmin has mentioned. There are other receptors. Okay, they should go. We don't need it. So these are the questions you will have from the acute pancreatitis, I think. So is there anyone who
And
would like to practice?
pancreatitis, we should not use non-steroid also, I think, right? Because we are giving steroid. So we cannot use the steroid as a painkiller, non-steroid. We cannot use non-steroid because to suppress the inflammation, we are giving the steroid for pancreatitis patient, right? So we
Yes,
should avoid morphine as well as non-steroid anti-inflammatory drugs.
exactly. And the anesthetic also causes respiratory depression.
Yes.
Okay,
Acetaminophen is not NSAID.
it's kind of anesthetic,
Paracetamol.
not kind of anesthetic, but a COX-2 inhibitor like this way, but it's not that much strong like the other anesthetic really works, prostaglandin synthesis and any other thing. So you can use in some
Paracetamol, I don't think it's a non-steroid.
yes, non-steroid. Okay, is there anyone
Yeah,
who want to participate in any other station? We do have left 2 stations more. I would suggest Dr. Kaushik Hauradar. If you would like to practice one station, are you okay?
Yeah, but
Are you ready to practice?
can you hear me?
Because
Yeah,
practicing is the key. I always suggest you, like Riaz Bhai practices for the first time in his life, and and I can assure you that he will practice in every subsequent day. And he just
yeah,
Inshallah.
remove his fear, and I mentioned that he's not that much fluent in the English, and it is not the exam of English testing exam. So nothing will happen. Just express yourself, whatever is going on your mind. Just if you are not enough to make a complete sentence, just say the word that are going on your mind just haphazardly. That will bring mark. Okay, nothing to worry about, bro, because if you pass part A exam very perfectly, and definitely you will able to pass the part B exam. I can assure you. I have seen so many candidates who pass very easily. So stick with the system, stick with the professionalism.
Practicing.
Practicing is key. So, Dr. Kaushik Haladar, you are.
yeah, but I am here.
Is there any actor? And
Yeah, I can be the actor.
okay, then Dr. Kaushik,
Yeah,
the question, then I will start the timer.
okay, I cannot see the question.
Can't you?
Oh, yeah, I can. Yeah. Which question?
This one.
30 years old man presented to, okay. 30 years old man, male, presented to you with abdominal pain and diarrhea for last 6 months. Okay.
This is your timer. Your time has been started. Start your history taking.
Okay. Hello, this is Dr. Kaushik, one of the surgical candidate. May I confirm your name and age, please?
Yes, I am Sharmin, 23 years old.
Okay, Miss Sharmin, nice to meet you. Uh, okay, Miss Sharmin, how can I help you today?
Actually, doctor, I'm passing loose stool. It's been a long time and also having pain in my tummy.
Oh, I am very sorry to hear this. So, Miss Sharmin, I am here to ask some questions regarding your problem. Okay, may I proceed?
Yeah, sure.
Okay, thank you. That's great. Okay, Miss Sharmin, can you please see me? How did your problem started? It is suddenly or gradually?
I think it's gradually. Since last 6 months, I'm having this problem. Passing
Okay,
loose stool like 4 or 5 times in a day, and sometimes I
okay.
notice blood also. It's
Blood.
very
Oh, I'm so
disturbing for
sorry.
me.
I think it is very much trouble to your life, day-to-day life. Okay. Is there any aggravating factor or relieving factor of your problem?
I went to consult to my GP and he wrote some medicine. I'm taking that, but I don't feel it's working for me.
Okay. Do you have any stress?
Uh, as far as remember, no.
No. Okay. Okay. Regarding your tummy pain, can you please say the exact location of your tummy pain?
I don't know. I think full area. I have no idea actually where exactly it is.
Okay. Can you please score your pain on the scale of 0 to 10, in which 0 is the lowest and 10 is the highest?
I think it will be like 7 or 10.
7 of 10. Okay. Is there pain is going after defecation or passes of stool?
No, doctor.
Okay. It's present all the time?
Uh, Nowadays I'm having back pain. I don't know why. It's all the time some discomfort is there.
Okay. Okay, Mr. Sharman. Do you have any weight loss or tiredness or anorexia or loss of appetite?
I don't feel to eat nowadays, and I think I lose some weight because my outfits are not fitting like before.
Okay. Do you pass any blood mixed stool?
Uh, Not every day. Yeah.
Okay. Do you have any joint pain or skin problem or any eye problem?
Joint pain, like I mentioned, like I'm having some back pain. Apart from
Back
that,
pain.
no other issue.
Okay. Have you had any history of hospital admission previously?
No,
Okay. Do you are you suffering from any long disease like diabetes mellitus or hypertension?
no,
Okay. Do you take any drug regularly?
and not regularly, but recently for this pain and loose motion, doctor prescribed some medicine, but I cannot mention the names.
Okay. Okay, Ms. Sharmin. Are you? I'm very much sorry to say. Are you suffering from pain exactly now? Do you have any? Do you need any painkiller?
At this moment, no,
Okay, that's good. Uh, okay. Do you have any allergy
no.
for some drug or foods? No. Okay, great. Uh, all of family member are good.
I think my father had these symptoms, and he passed like
Okay.
it's been 2 years now.
Oh, so sorry to hear this. I'm so sorry. Okay. Ms. Sharmi, now I am going to ask some personal question. Okay.
Yeah,
Are you,
sure.
are you okay? That's great. Okay. And do you smoke or taking
Mm,
alcohol?
Uh, I'm drinking alcohol occasionally, it's not regularly.
Okay. 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 What do you do for live?
I'm doing job in a shop.
Shop. Okay.
But
Have you, do you exercise regularly or not?
I don't get time that much. No.
Okay. Okay. Ms. Sharmin, do you have any idea or concern regarding your problem from us?
Doctor, actually, my father died 2 years ago. He had same problem. I don't know what's wrong with me, so I'm really concerned about this.
Okay.
And I'm doing
Don't.
job in a shop, so 2, 3 times I had to go to toilet. It's hampering my daily activities. So
Okay.
I
So
might lose my
sorry.
job.
Okay, Miss Sharmin, don't be panic. You are in good hands. Okay. I am already asked all the question and compile your all the problem. Subsequently, I will consult with my consultant regarding your problem, and you will be noticed subsequently. Okay, don't be panic. Okay,
Alright,
Ms.
thank you.
Sharmin, thank you for your nice cooperation.
You're welcome.
Okay, thank you.
Okay.
Sir, I have completed all the questions.
Okay, my dear friend, you completed 30 minutes before finishing your time. It's no problem. I completed my history taking 1 minute, tonsillar swelling 1 minute before finishing the time. So it's not a big deal, but I would always suggest you always try to finish within the time. If you are finishing your exam 10 or 20 seconds before the exam, that's okay, but don't wait until the bell ring, then we'll finish the your station, because you won't get the time after having the bell. So always try to
Okay.
finish the station before the time. Just go with the same
Okay.
flow from the very beginning of the station, because if you are very reluctant at the beginning of the station and you are in a very hurry at the ending of the station, and that will lose you some mark. So always practice such
Okay.
a way you are in the same flow in the from very beginning of the station. So practice is the key. I always say practice is the key. So if you are practicing, that's okay. So
How much time I need more?
uh,
How much time have I get?
you are completely okay. At the same time, I would like to finish you.
It's
Yes, you are having
mo-
you took 5 minutes and 36 seconds. Okay,
okay. Okay.
Dr.
All,
Kaushik, would you say how
okay.
was your station?
Yeah. Sorry, Rifat.
How was the station?
Actually, I just walk in my room. So you were just call ask my name, and I okay, okay.
So, Dr. Sharmin, would you like to comment regarding your Kaushik?
Yeah, yes, I would like to say something. Dr. Rifat, actually, you did very well. It's my opinion. Like, you missed I might take some notes when
Mhm.
you take that.
Yeah.
Then when you take the history, I said I'm having first open question. You asked, what is the problem? How may I help you today? I said I'm having
Yeah.
pain. You didn't ask for a
Yeah.
painkiller or anything.
Yes, yes,
And next, when you started to take my history, I said like I'm having loose motion. You didn't exclude my motion, how many times, but I was thinking, I was telling, right? Say seven,
Yeah.
five,
Yeah.
3 times. And you should ask like, when did you pass the last time, right? Like last motion. Like regarding motions, you finished
Okay.
within time.
Yeah.
Yeah, I finished within time. This is also important to get marks.
Yeah.
And
Yeah. Yes.
yeah, apart from these things, you did nicely. No need to ask so many questions, but you asked. That was good.
yes. Dr. Kaushik is in a very good track. I think he's a very good track right
And
now.
Dr. Ripat, actually, one more important thing, actually, when you are taking, like, it's depend, like, when you be my partner, right? Like, my actor. It's very important,
Yes,
like, who is giving you the history. It will be short.
yes.
No, no, no,
True.
no. If you're giving that, he can feel on time. Trust me.
But,
But if you are just, why I will tell the history regarding my time, you asked me, right? Why I will tell you? Then I have to console you, Dr. Calm down, because it's very relevant for you. Then extra things when we are going to do, because sympathy empathy is a part, right? I cannot be rude, like it's a part of history, you have to tell me, I cannot say like that, right? So when we are going to do some extra things, it's taking extra time. Okay, but if
Yeah.
the actor is really a professional, it will finish within time. If you know the differentials, for sure, within 6 minutes it will be finished. But if I'm giving long history, it will not finish.
yes, but believe me, in the real station, maximum
And this history is like long time diarrhea and abdominal pain, right? So have to focus,
Yeah.
this is inflammatory bowel disease. The actor will act on inflammatory bowel disease. So you will also have to keep in mind this is inflammatory bowel disease. So
yes,
you have to exclude first this one, then rest of the thing, yes, no, yes, no. He
yes,
will answer yes, no, 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 no. But if I'm saying past history, so many things, but this is relevant, inflammatory bowel disease, family history could be positive. Like alcoholic patient, it could, like, sorry, acute pancreatitis, alcoholism is very important. You have to exclude smoking, alcohol, right? relevant. So they will sit like that to give you this information.
Yes,
Right?
always remember whenever you will get the question like abdominal pain and the diarrhea, your diagnosis is IBD. Don't ever
Yes.
establish it is
And then
IBD.
the same also written like that, long-standing diarrhea with abdominal pain.
Yes,
Abdominal pain is not that much significant here. Maybe patient will have some weight loss, maybe some bloody diarrhea, and sometimes pain. But mainly they will give the pain is radiating to the back, some joint pains, right?
yes.
Like that.
In your
Anyways, he did very well.
exam, you always get the abdominal pain and long-standing diarrhea. So always your diagnosis would be IBD. Don't try to establish it is
Yeah.
IBS or carcinoma of the rectum or carcinoma of the colon. Don't do this. I'm telling Dr. Riaz Bhai and also Dr. Tanvir Bhai, these are the persons, special. These are the very knowledgeable person, and these are the very close to me, and they are consultant, and they know so many things. At the beginning of the session, I said, is not the station of performing your knowledge or
Yeah,
some.
I'm working in Maldives actually, so I have two Egyptian colleagues recently passed. I went there to talk to them, right, regarding exam. Recently they have been passed, not this exam, before that. So they are said, I said like, sir, it will be very easy for you people because you are taking, dealing so many cases and more experience than me. They're saying, Dr. Sharmin, it's not about that, like specialty.
Yes.
It's like all about that things you will forget. He was saying, I was reading the stem. I was thinking, what is the stem? Where I'm going? He was acting like that. Because we have to 17 stems we have to read before we enter into the room, right? So he was
Yes.
thinking, which station is that? He is so senior to us. He's
Mhm.
from Egypt, actually, like that. They're very acknowledged, definitely. They're surgeons, everybody knows. But for us, like, he was giving advice. Go through the notes. Actually, he's one of Dr. Salah's friend. He was recommending me for Salah and asking, and said, go through the notes and practice, 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 and practice. Was saying like that.
Mhm.
Keep doing whatever in the materials.
Yes.
But in spite of everything we are failing, I don't know what we will do.
All the materials are same. Stick with the materials.
Yeah, that is the panic. We know everything, but it's very scary exam. Don't know what we will do in the final exam.
Okay, Dr. Kushik, you are on a very right track. I think you just need to practice much more, but I think you do have a huge lackings with the coordination of the questions and
Yeah.
implement of the 5 questions I have shown you at the beginning with the Dr. Uh, Sharmin or
Riyad bhai.
Riyad
Yes.
bhai. Yes, on Riyad bhai case, I showed you 5 questions at a time, but you didn't, after you asking hello, good evening, sir, you would always have to wait for the reply, but you didn't wait for the reply. Definitely the patient will say.
Yes. Yes.
So before saying
Yeah.
something else, you started so many things to say, so that that's not
Okay.
so. Always try to seek for the notes because you do have marks because the paper and pen are kept to take some notes. That's why you will have to seek the permission to have some notes. So you took 2 times consent after what is the problem. After seeing the problem, you again started, may I go few more questions, something like that. So you will have to ask the consent 1 time, I think, because you do have very limited time. So be very practical way and professional way. So don't ask 2 or 3 times consent. Just ask the questions once and start asking the questions. You do have,
Okay.
you showed some empathy to the patient, but with your voice, just like this, okay, I'm sorry to know that. But if you say like, oh, actually sorry to know that, like you are having the pain of the patient, it's true, we are not able to have the patient's pain, but show some empathy, fluctuate your voice tone with the patient because it really
Okay.
matters. It really matters. I used to practice one of my friend, and he passed on the third time, and on the third time he was just practicing with me, and he used to do this thing. And I was just saying, so why are you doing like this? So it's so silly. But he said me, my dear friend, is the key to success. It's really
Yes, I actually, Rifat, I feel this, that there is a lackings of me.
yes.
There is a fluctuation of my voice,
You
and
do
I have to try back with you, brother.
you will have to fluctuate your voice with the patient's pain or patient's condition. Always try to make your facial expression or just always try to focus the facial expression of the patient. If patient laughs, you are allowed to laugh. If patient cry, you are allowed to cry. So always patient is your first priority, right? So patients is a very important thing. You'll have to fluctuate your voice with the patient. Then you after having so many questions with the patient, and patient is having in a very big pain, after that, at the end of the taking Socrates, you offer the patient any painkiller. So you will have to start the painkiller. Do you need any painkiller right now? If the patient said yes, I do need, then ask the examiners, sir, patient needs painkiller. The examiner will ask you, suppose your patient have some painkiller. Okay, proceed, no problem.
Okay,
Sometimes patient also say, may also say that he needs some painkillers. So on that way, we'll have to solve this issue, right? So I think you
okay,
forgot some systemic reviews, to take the some systemic reviews at the end of the session, end of the history taking. And all of you except Dr. Sharmin, I think forget to ask, would you like to add something? But because you are talking for long 6 minutes, and the patient is answering for long 6 minutes all the questions you are seeking for, patient may there might be thing to tell you, patient may have something to tell you. That's why you do have this keep a option for the patient. Do you need anything to add at the end of this history taking, like this way? Okay, that ends our conversation. Do you need anything to add that I have mentioned to ask you? I have forgot mentioned to ask you, like this way, right? So you
Yeah.
okay,
The
okay.
systemic questions and that last one.
yes, yes, yes. So
Yes, yes.
you come to the personal history. On that case, always remember, guys. I don't know why you are doing the same mistake again and again, because family history is also a personal history, and it includes within the personal history. So keep the family history within the personal history, and you'll always have to seek for the permission regarding starting the personal history. So don't ask the personal or family. Personal means family history, basically. I am focusing on just
Okay,
put the family history into the personal history. Like the 5 or 6 questions are same on the every patient, every except 1 or 2 stations. We'll have to keep the family history in the personal history, right? So after seeking,
okay,
I would like to know few more personal question. Then what do you do for living? What are you living with? Do you take any, do you smoke, or do you take any alcohol, like this, right? Is there anyone in your family is having the same problem like this, right? So you will have to
okay,
manage this thing, but you ask every single stem, but in a very haphazard way. So my suggestion is, just keep the history in a very proper way, and keep them in a single format, so that you are not looking for new things in the exam center. Just keep the whole history in a single format. So just follow the single format,
okay,
just change the differentials, nothing else. So you pass, nothing to worry about.
okay,
That's all about for you.
okay, Rifat.
So I won't like to ask the differentials and other things. I think you will be able to answer everything. So come to the another stations, the last one for today, and that is kept for Dr. Jyoti. Are you there, sister? Okay, Jyoti. So this your station, Dr. Jyoti, and she's very
কিছু তো দেখা যাইতেছে না ভাই।
actually, can't you see anything?
No.
Okay, use English. Can't you see anything? Everyone, can't you see anything?
Yes, Bhaiya, I can see.
Dr. Jyoti, can't you? Apu?
No,
Why?
network problem.
Okay, your station, just listen. I'm reading it out for you. Our candidate name is Dr. Jyoti, and Dr. Tanvir Bhai is the actor. He is very silent for today. I don't know why. So I'm choosing Dr. Tanvir Bhai for this station. So are you there, Bhaiya?
Yes.
Yes. Okay, Dr. Jyoti is the candidate and Tanvir Bhai is the actor. Jyoti, your question is 28-year-old female referred to you from the GP with a complaint of abdominal pain with gallbladder stations. Take the history from the patient.
Hello, I am Dr. Soida, one of the exam candidate. May I confirm your name and age, please?
Yes, good morning. I'm Dr. Tanvir.
Nice to meet you, Mr.
50 years old.
Nice to meet you, Mr. Tanvi. Today I have been assigned to ask you some few questions regarding your condition. During our conversation, I will taking some notes. Are you comfortable with this?
Yes, thank you.
How can I help you today?
Okay, I have some tummy pain in right upper part. Hello?
Jyoti, are you there? Hello? I think she got disconnected.
Anybody may continue.
Anybody here would like to participate? Dr. Taman,
Rishad?
are you there? Rishad, brother, are you there?
Anybody should practice.
I'm the patient. I'm the patient. Dr. Tanvir, please continue. You are the candidate.
Okay. Will you please tell me whether this is gradually or suddenly
From the beginning there.
started?
From the beginning.
Yes,
Otherwise, it
yes.
will lose the harmony.
Yes, I am Dr. Tanvir. Today, I am here to ask you some questions regarding your health that will be very helpful for you. May I proceed?
Yes.
Will you please confirm your name and age, please?
Yes, I'm Jyoti, 28 years old.
Okay, thank you, Jyoti. Will you please tell me by how can I help you?
Yes, doctor, I am having tummy pain
Okay, for how long?
for the 6 months.
Sorry, will you
For the
please
last
repeat?
6 months.
6 months.
Yes.
Okay, I'm sorry to say. Do you need any painkiller right now?
No, doctor.
Okay. Does it gradually increasing or suddenly increasing?
It's persists in the same manner for the last 6 months, I think.
Okay, what is the character of this pain?
Could you tell me what is the
Is it
character?
severe, or it is very severe, or cramping, or colicky?
I think it's a colic in nature.
Okay. What is the site? Will you please point out by using your finger?
It's basically all over my tummy, but it starts at the middle of my tummy, around the belly button.
Does it radiate to any site like back or tip of your right shoulder?
No, doctor.
Does it get aggravated with taking a fatty meal?
No, doctor.
Does it relieve with taking something else like medicine or taking rest or any topical application of something?
After after passing the stool, the pain relieved.
Okay. Will you please make the grading of the pain like grade 1 is minor and grade 10 is severe?
I think it's 5.
Okay, thank you. Will you please tell me whether any loss of your weight or loss of appetite? Do you think?
No episode of losing weight or
Do
loss.
okay, thank you. Do you have any yellow discoloration of your eyes or your skin or hands?
No, doctor.
Do you have any bowel or bladder abnormality like loose stool
Mm,
that doesn't stuck to or that is stuck to the pen or commode? What do you think?
no, doctor.
Okay, thank you. May I ask you some question regarding your past medical or some medical history? Do you have any history of going to GP for any kind of illness
Mm,
like pain or?
sorry, আমার network disconnect হয়ে গেছিল।
okay, just
We are proceeding. Okay.
just let Dr. Tanvir to finish, then just I will discuss with the question with you. No problem.
Okay.
I'm asking about whether you have any history of going to the GP for any medical problem, surgical problem, or any medication. Can you hear me, Rifat? Jyoti?
I can hear you.
Patient is Jyoti.
I can hear you.
Do you have any history of going to a GP for any medical problem?
No, I haven't done.
Do you take any medicine?
No, doctor.
Do you have any allergy to any food or any drug?
No, doctor.
Do you have any family history of such kind of illness?
No, doctor.
Okay. May I have some personal question regarding your history? Like, do you smoke?
Sometimes, occasional.
Okay. How many sticks can you memorize?
It depends. Basically, sometimes one or two.
Oh, you are the occasional smoker, I think, Jyoti. Isn't it? Okay. Do you drink?
No, doctor.
Okay. So, do you have any chest pain or bowel bladder abnormality?
No, doctor.
Do you have any headache?
No, doctor.
Do you have any body pain?
No, doctor.
Will you please tell me what is your main concern?
Doctor, my main concern is that I'm heavy much in pain with my tummy pain, because whenever I am in a very stressful condition, my condition becomes getting worse.
Okay, Jyoti, I understand your concern. Don't worry. We are all here to help you, and we will discuss your condition, and we'll go through some clinical examination, investigation, and we'll contact some senior consultant. So don't worry, we'll help you from our side as many as we can. Will you please tell me that what is your expectation from our side?
Okay, your time is up. Okay, I got the another.
Okay, thank you. Do you have any another question?
Okay, Tanvir, you did very well. But one thing I have noticed that
Documentation. I missed the documentation because I.
yes, one thing I have noticed that in every candidates except the first one, Dr. Shami, all you guys do have some lackings in the coordination of the history. Because I always, from the very beginning of the session, I always used to say every single thing in the same format. Because if you break the format, if you bring the history at the first, if you bring the personal history at the first, you will forget to mention another thing. Because as you do have the individual like in every single section, you will lose. You will if you don't follow the chart, if you don't follow the same format, you will forget so many things that will lose some marks. So always try to follow the same format. Or I don't know, but Bhaiya asked me or not, what do I do for living, whether I am living with, uh, who lives with me, these things. As far as I can remember, he didn't ask me.
I missed.
You don't follow the format here. So you did very well. Same tone for the whole conversation. That's very good. I do appreciate because as Dr. Sharmin did well, but she didn't follow the same tone, same pace, and the whole session. But you follow this thing, and you mention the keep the your tone in the same pace for the whole session. So that's a good point because you are not in a hurry and you are not in a lazy situation. So you are in the same pace for the whole thing. So guys, always remember, don't make hurry, don't slow down, always go in the same pace for the whole conversation because you do have marks on this section. So always keep the whole thing in the same format, otherwise you will forget to ask. Like Dr. Tanvi, he practiced a very lot, but suddenly I invited him to practice, but he forget to ask these things to me. So you'll have to maintain the same format. If you follow the same format and you forget to ask few differentials, I can assure you, that you will pass definitely. I can write it down for you if you follow, at least from the history section. Just follow the instructions, follow the things. History section is a very simple thing, but still our candidates do very bad in the history section. That's why I always give emphasis you. I always saying you that keep the emphasis on the history section, history taking stations, because you do have a huge possibility to gain the mark in this section. Right, Dr. Tanvi, are you okay?
Yes,
Okay.
yes.
Are you there, Dr. Dutti? Are you there?
Yeah, yes.
Okay, so would you like to present the case or say the positive finding? Can you remember what are the positive findings in case of IBS? Because the things are same in every single station.
28 years old lady presented with abdominal pain and gallbladder stone diagnosed in ultrasound. Pain started uh, and gradual onset, intermittent in course. It poorly localized, diffuse in abdomen, colicky in nature. But pain is not radiating anywhere and is moderate to minimum in severity. And it's not associated with any blood mix stool or any bowel disturbance. It's the pain is relieved by passing stool, and she experiences more in case of her stress is gradually increased when, and no manifestation of biliary colic also. So based on this, my diagnosis is inflammatory irritable bowel syndrome.
Okay, that's great. So why did you get that the patient is having gallbladder stone and that was diagnosed with the ultrasonogram? Did you get any investigation or something?
Ultrasound.
So how did you get that the patient is having ultrasonogram?
এটা তো আমাদের জানা কেস।
তো কোথাও লেখা আছে এটা আল্ট্রাসাউন্ড দিয়ে ডায়াগনোসিস করা আছে?
না।
So don't say anything that is not mentioned in your exam. Don't
Okay.
hide anything. Don't say anything extra that is not given in your exam or in your question script. We know very well that ultrasonogram is the main investigation for the diagnosis of the gallbladder stone, is the most important and main one. but still you are not allowed to say anything that is not given in your exam script. Okay,
Okay.
so don't do this. And you are I all of you for guys, I said, you would you like to present the case or say the positive finding? Always try to pick the positive finding. Don't try to present the case, because if you say only the positive finding, you do have, if you can say the positive finding, you do have marks, because there is no extra mark for the present the case if you do say the only the positive findings. But if you are in case of positive findings, you can finish the questions very early so that you can answer other questions very properly, right? So I would always like to say you try to choose the positive finding, because in every session examiner will ask you, would you like to present the case or positive finding, right? So that you the IBS. So what is the treatment?
Mainly dietary modification, high fiber diet, low residual diet, adequate hydration, anxiolytic, and we can also add for antispasmodic.
And exactly, anxiolytic, antidepressant mainly, huh? As the patient is having with the anxiety disorder, anxiolytic and antidepressant. These things are the main problem, and the patient is having a tummy pain. That's why antispasmodic and the dietary habit is should be changed, like milk and wheat and something like this. So these are the things that was in our today's schedule. We have I think we have completed every single thing. Uh, you guys did very well in the session, and I think I don't know whether I ran you well or not. Please comment, say something that so that I can improve myself for the next session. Dr. Sharmin, she participated for the long 3 hours. Are you there?
Yes, I'm here, Dr. Rifat.
How was it? I'm okay to run the
It's wonderful. It's really appreciable that you are giving us time. We can improve ourselves because you do have experience and you are criticizing us, which is very important. I'm practicing, but I don't know where is my lackings. So it will not improve me.
yes.
You are helping a lot.
MRCS OSCE journey. In case of MRCS OSCE journey, I noticed it's very in a big way that uh, everyone practice, but some of them who practice all the day long.
One thing, Dr. Rifat, actually, because I don't know how many January candidates are here or December candidates. But for me, I'm the January candidate. It's really very helpful. But when you are going to start any kind of sessions like history taking, right? Before start, you can give us some instructions.
Yes.
Okay.
At
Because
the
every day, every day,
yes.
if you're giving instruction, it will take a long time. You can permit me, like if you're giving 5 stations, that means 50 minutes, right? You can give us 50 minutes. Every individual will get 10 minutes, not more than that.
Yes.
Okay. So first you can give us some instructions like this protocol you have to follow. There are 2 history stations will come to your exam, and these the steps you have to go one by one, like a class. Or before we start, you can give us some demo, like next we will do
I thought
clinical.
every one of you is practicing like that way. That's why I just
Because no, I'm sorry. I'm sorry if I said anything. Like every day if you're cracking, it will take long time, right? And it will be monotonous. Everybody, I don't know about everybody. Like I have duty also, right? So with duties I'm managing, but I love to be with you because I'm learning, right? Because when you're criticizing and telling about the exam environment, it's really helping me a lot. But if say single person, if we are going to do like that, it will take a long time,
yes.
right? So beforehand, you can give us some instructions that clinical station is like that. We will start to practice. As I was literally one time I practiced with time also with some other partners, like fixed time. I will keep the alarm, time up. Then I will have a pen and paper actually, sum the box.
Yes.
That this part you missed, I was telling because I was marking like tick. She said past history, tick, tick. I was making a box because I was conducting the session. Okay. So I was thinking like, that is the history part. He said, by presenting history, he tasked, I will give a tick, tick. Which part he missed, it will very easy for me to criticize the as you were helping us, right? So it will be very helpful if you're saying, Dr. Shamin, you didn't mention about the personal history, because in that box I give a like dot because he missed that part. You didn't take the consent. Okay, I was taking like that. Then it will be very easy for you also to criticize us, which part we missed. And one thing you said truly, look, I am talking, it's literally rude, I think, but I
No,
don't know, my voice tone is like that. you know,
no, no, no,
I
no.
was, it's Dr. Tanvir Bhai was like very ear soothing when he was talking. I was simply listening how clear and loud he was talking.
Yes, yes.
And seems like I'm really in a safe hand. The patient will really feel like that. I'm a very
I
safe
already
hand. The
mentioned that
Tanvir Bhai was
Tanvir is
talking.
very expert and he is a consultant.
Really, wow. I was listening, but genetically we have some here voice tone. I cannot change it, so I should work on it. To be honest, I like literally I'm going a little bit fast. But Tanvir Bhai was like, yeah, but that's why one thing, Dr. Rifat, Tanvir Bhai couldn't finish on time because he was going very nicely and slowly,
He was
just
also
going, oh,
yelling.
yeah. I was feeling like Dr. Tanvir Bhai is having coffee and talking with patient. So relaxed.
Yes, at the beginning of the history, he was yelling. Well, just he is.
Yeah, well, okay, tell me. I understand. Okay, all right. Then tell me like that. He was doing like that, but comfortable. Patient will feel like I'm in a safe hand.
So
And
thank you
what?
very much, guys.
I think there will contribution from Rifat's side to make me relay.
No, really appreciate Dr. Rifat, and thank you very much for like arranging such a beautiful sessions and mock sessions for us. It's really helping us.
Problem sister. Thank you very much.
Definitely. Yeah. And Bhaiya, can I say something before we leave?
I'm so angry with you because you didn't. You pushed me. You the one of the most important person who pushed me to drive the mock session here, and you didn't participate for the wrong.
I'm so sorry, Bhaiya. Thing is, I haven't started completely, but I'm trying to grasp the whole idea. Like I just started. You understand what I'm saying?
No problem.
So
Very familiar environment. This environment is very familiar and homey environment. I will assure you that it would be always a homey environment so that you can
I
participate
know.
and
Inshallah, I will. I
definitely
need some time.
has I always expect you to join every single session with actively. Thank you very much. Is there
Inshallah, Bhaiya.
anyone would like to add anything that I have forgot to mention? Is there anything? Is there anyone who would like to add something? Say anything before ending the session? So guys, I think it's time to say goodbye for today. We will have another mock, another day, another schedule that would be changed in some way. Then I would let you know. But follow the next mock session. Inshallah, we will come to another session very soon. Allah Hafiz.
Hafiz, Bhaiya.
Thank you for your kind participation.